Great, I think we'll go ahead and get started so we don't waste any time. So again, a warm welcome on behalf of the Boost community and Momentum's global and country leadership to our webinar, Introducing the Immunization Agenda 2030 Scorecard. Before we get started, I want to go over just some logistics for today's session. We are using a Zoom meeting format today, so I do ask that you please mute yourself when not speaking to limit any background noise. You can always engage in dialogue with your peers and session facilitators through the chat box. Please also use this forum to ask any questions throughout the session. Once we get to the question and answer section, you may raise your hand to voice over any questions if time permits. And just a reminder also that we will be recording today's session and it'll be available on the Boost community platform a few days following the end of the session today. So for those who are joining us for the first time, the Boost community is a diverse network of nearly 3,000 immunization professionals from 140 countries. Through our online platform, boostcommunity.org, we offer opportunities for our community to connect with peers, strengthen leadership and advocacy skills, and grow in their careers. And then, so after I'm done with the introduction, I'll hand things over to our colleagues at the Johns Hopkins Bloomberg School of Public Health and the World Health Organization, who will review the impetus for today's event, including the vision for Immunization Agenda 2030 and some key features of the new scorecard. We'll then transition to some facilitated breakout rooms to dive into the scorecard in a bit more detail. And finally, we'll hear from our colleagues in each of the groups as they report back on what they shared. And with that, I'm actually going to hand things over to Chizoba Wanoni, who's going to kick things off with a brief overview of today's event. Over to you, Chizoba.
Thank you so much. Good morning, good afternoon, good evening to our distinguished participants to this event. I'm really excited to kick things off and to introduce what we have installed today. So we have a pretty exciting agenda as Liz has just run through. So my job right now is really to just give you an overview of the event and the scorecard. So what we want to do today really is to solicit your input on this new scorecard that is being developed by a partnership that includes the WHO, the CDC, other global immunization stakeholders, and this is all coordinated by the Momentum Country and Global Leadership project, which is a USAID funded project. Just a quick overview about the Momentum Country and Global Leadership project. It is a 5-year large global project that is part of a suite of awards by USAID to holistically improve family planning, maternal and child health, including immunization in partner countries around the world. MCGL, or Momentum Country and Global Leadership Project, focuses on providing technical and capacity development assistance to ministries of health, as well as supporting global leadership in immunization. So it is this part of the global leadership in immunization that has really supported the partners that I mentioned earlier on in coming up with this scorecard. So for today, we want to ensure that we tap into the vast knowledge and expertise that you all carry as members of the Boost community and as immunization practitioners in the countries. So what we want to do is to show you the scorecard, and then we'll go into breakout rooms to have further discussions around it. And without much ado, I would then like to hand over the next agenda item to my colleague Rose, which is going to be a poll. So Rose, over to you. And then after that, I'll hand over to our colleague from WHO, Dr. Alba Ropero. Thank you.
Yes, I think there's a poll being launched by our colleagues at the Sabin Vaccine Institute. There we go. So this is, what region are you joining us from? African region, region of the Americas, Southeast Asian region, European region, Eastern Mediterranean, and Western Pacific. So I think this will go for another 30 seconds or so.
Great, I'll just give everyone a few more seconds to respond, and then I'll share the results. Great, so based off participant responses, we have about 44% joining us from the African region, 16% joining us from the region of the Americas, 16% joining us from Southeast Asian region, 8% from European region, 12% from Eastern Mediterranean region, and 4% from Western Pacific.
Great. Thank you so much, Liz. Is there going to be another question, or that's just it for the poll?
That's everything. So back over to you.
Excellent. Thank you. Thank you so much, Liz. So this is great. We do have representation from all the regions, albeit some regions are, have more participants than that. But I think that we're still going to get a rich feedback from all of you. So without much ado, I would like to then hand over to Dr. Alba Ropero from World Health Organization to give us the vision for Immunization Agenda 2030. Dr. Alba, over to you, please.
Thank you, Dr. Chisoa. It's a pleasure to be here today. Good morning, good afternoon, good evening. I am Alba Maria Ropero. I'm delighted to be speaking with you today in my role as a WHO lead for the Immunization Agenda 2030. I just came from Pajo region after 22 years working on immunization programs at regional and national levels. And then I am happy to be part of this global community now working with you. And I would like to thank Johns Hopkins University, Sabin Institute, CDC, and USAID, and all partners organizing this important meeting. As you know, vaccines are one of the most cost-effective tools in public health, and they save more than 4 million lives every year. Maintaining and increasing this achievement is the shared ambition of all of us here in this meeting and all over the world in order to use vaccines as a saving life and having healthy communities. However, as we also know, before the pandemic, the vaccination coverage has declined over the last 10 years, leaving more than 13 million children without access to vaccines. And with the pandemic, the impact of the pandemic and the essential health services has been very hard on the immunization programs, leaving more than 23 million children without vaccines. This means that it's around 3.7 more million children than in 2019. In 2020, the global immunization strategy was established by all UN member states, and the immunization agenda was launched. Even though this agenda was started before the COVID pandemic, the vision of this agenda remains transcendent, which is to create a world where everyone, everywhere, and every age fully benefits from vaccines for good health and well-being. Immunization agenda will help us to maintain the immunization programs in the political agenda. We just saw it last week during the 75th World Health Assembly that the Immunization Agenda Partnership Council and the Coordination Group members released a call to action. Partners are calling to channel pandemic response efforts into sustainable investments into primary health care, increasing efforts to catch up children who missed vaccination during the pandemic. In order to evaluate what is the real impact of this situation, we need better information systems and surveillance systems. We recognize all the efforts from countries getting data through the ERF, WHO, UNICEF mechanism in order to know better what is the situation. This work will help us to map population, inform research, clinical trials, access to real data, and identify and reach zero-dose children and missed communities with targeted vaccination and strengthen early detection and outbreak response, especially at subnational levels. We need to highlight these important tools and analysis at local level. We can evaluate as well how vaccines are protecting children, adolescents, mothers, adults, elderly, across the life course vaccines. In this context, we are here today having this discussion with all of you in order to see how the scorecard is an important tool for countries and partners in order to evaluate the performance of the immunization programs. That will be part of this meeting. And then I would like to highlight the importance of all of you participating in this webinar today, and having your inputs and to help us to improve the tools that we're presenting. And that will be very important in order to have better resources for decision making and immunization programs in countries around the world. And then we are looking forward to continue working with you and listening, of course, the results of this meeting. And then we'll be working from now on with all of you and in this process, and I am happy to continue working and participating in this kind of meetings. Thank you so much for the invitation, and then I will give you the floor back to Dr. Chisova.
Thank you so much, Dr. Alba. I really would like to appreciate you sincerely for jumping in on this call almost on your first week on the job, and you've done a fantastic job with the introduction, as if you've been there with us from day one. But you have been anyway. When you were at PAHO, you were part of the IA 2030. So this is just a continuation. So, my pleasure. So I'd like to invite my colleague, Rose Weeks. Rose has been the power behind the scorecard. She has coordinated all the work you're going to see today, bringing all the partners together, working with the developers, and really making sure that we keep this on track. It's my pleasure to introduce Rose Weeks, who is my colleague at the Johns Hopkins International Vaccine Access Center. Rose, over to you to tell us more about the scorecard.
Wonderful. Thanks so much, Zoba, and thanks everyone for being here. We're delighted to have participants from 54 countries, and including colleagues who work in ministries of health of over 20 countries represented in the participant list. These are just the people we really need to get feedback from on this important new tool. I work under the Momentum Country and Global Leadership Initiative supported by USAID. And we will just do a quick introduction on the scorecard and then really start just doing a tutorial of how it works. The scorecard is intended to be a visual representation of IA 2030, and that is the framework for action agreed upon by member countries in 2020 to make progress toward the targets set out in the Immunization Agenda 2030. The scorecard will strengthen and support accountability at the global, regional, and country levels, including ministries of health and civil society organizations. The scorecard visualizes data at 3 different levels: the global, regional, and country level. And the country pages that you'll see today and provide feedback on will be available in the 3rd quarter of the year. The scorecard will also highlight where data are not yet available. For some of these indicators, they are new, they've never been tracked before, And so some countries are starting to report on them, but we'll be hoping to encourage countries to report on all of the indicators through the joint reporting form and other means, through the presentation of the data in these visualized formats. And I think some colleagues stated this earlier, but just to reiterate, we are grateful for our collaboration with the Immunization Agenda 2030 advocacy and communication work groups and the monitoring and evaluation work groups with strategic decisions by the Secretariat of IA 2030 and the coordinating committee. This is a presentation, a sort of an overview of the scorecard itself. On the left, you'll see the overview dashboard, which is a visual that represents all the indicators tracked by IA 2030. So it has a number of indicators that are represented by impact goals, and then each of them has a target associated with it that is a target for 2030. So you'll see the first one is to avert 50 million future deaths globally. And so that is a global target. And each of these indicators that are related to impact goals has a global target associated with them. And what you'll see here is a presentation of what the scorecard will look like when we have the first year of reporting, which is from 2021. We'll know at a glance from this page whether the indicators are on track toward meeting the targets for 2030, or if they're off track by these indication of an exclamation mark in red or a check mark in blue, or if there's not really a change, and that's with a gray box. You won't see that on the live scorecard yet because we are still looking at baseline data for what we're reporting now. And so we can get to that in just a moment. You'll see on the right, there's a visual of one of the impact goals. This is for the achievement of all vaccine preventable disease control, elimination, and eradication targets at the global level. You can see at a glance here that 99% of countries have met an established target to eradicate wild-type poliovirus. But by contrast, at the right, you'll see that of the countries that have endorsed a target for measles, which is, I believe, 5 of the 6 regions, we have 61% of countries meeting that target, and then a number of countries that are not yet meeting the target. The countries that are represented in the white bar are countries that haven't yet endorsed a target for measles elimination. And so there are additional charts like this for the other diseases that are being tracked. And I'll show you in just a moment what it looks like on the live version of the scorecard. Just one more slide. That wanted to make sure that we see there will be country pages for every country, and those will be a simple reporting of all the indicators that are being tracked by the agenda and a number associated with them. So here you can see this is not real, these are not real data, but for Pakistan, you'll be able to see at a glance if Pakistan has achieved an eradication target for poliovirus. This one shows, again, not real data, but that it hasn't met the target for measles. And then for tetanus, it shows that it doesn't have a target established for tetanus. And so you can also compare from one country to another country by toggling at the top here, where it says compare against another country, and you can compare to the region as well. And with that, I'd like to show a little bit more about how the scorecard works by just kind of clicking through one of the indicators, and I just want to make sure I'm still on track. I think we're going to be moving into our next session very shortly, but I wanted to show how it works to move from this dashboard to a cardinal indicator page. This is one that everyone is very interested in, the goal to reduce the number of zero-dose children by 50% by the year 2030. At a glance, you can see that in the first year we have data from, which is 2020, we've actually increased the number of zero-dose children by 50%. And that's moving in the wrong direction. We want to be moving in this direction to reduce by 50%, and we're so far actually moving in the opposite direction. If I click explore the data, you can see at a glance here that the number of zero-dose children, which is a number of children who did not receive their first dose of DTP, has gone from 13.6 million in 2019, which is the baseline year, to 17.1 million. And so that is not trending in the right direction, which you can see is intended to go down to 6.81 million in 2030. And so that's just an example of how the scorecard is intended to work. Make this agenda highly visual and interactive. And I will leave it to you to interact with the scorecard. I'll put the link in the chat so everyone can click through, because that will be really key to our next discussions to really hear from you, which is really the core of this meeting today. And with that, I will turn it over to some of my colleagues from the Boost Network who are on with us to help facilitate these discussions. Liz, are you able to introduce those colleagues?
Sure, and actually I'm just gonna head it over to each of them to introduce themselves. So might start off first with Dr. Ahmed.
Hello, my name is Ahmed Naveed Nusrat. I am speaking from Pakistan, and I am working in primary and secondary healthcare department for more than 10 years. My prime expertise are in the expanded program and immunization. Most oftenly, I do the trainings of all vaccination staff, that is vaccinators, lady health workers, community health workers, for getting better immunization activity. I most oftenly work in the underserved and marginalized areas. So that needs much attention of the health department for improve the standards of deserving and needy people. And I'm also as a Boost member from many years and a scholar from the Geneva Learning Foundation. This is all about from me. Thank you so much.
Thank you so much, Ahmed. And then over to Dr. Hilarious.
Thank you, Elizabeth. My name is Dr. Hilarious Abiu. I'm a medical doctor by training, and currently I work with the Ghana Health Service in Ghana, West Africa. I'm the Deputy Director in charge of Public Health, responsible for the Northern region. And as part of my roles, I'm directly responsible for implementation of public health policies from the Ministry of Health within the region. Key among this is the rollout of the COVID-19 response actions, including immunization and also routine immunization recovery efforts from the pandemic. I'm also a member of the Boost community. Thank you.
Thank you so much, Hilarious. And then over to Oniovo, who is also joining us.
Hi, everyone. Good afternoon or good morning, depending on where you're coming from. My name is Oniovo Ife Aluta, and I work with WHO at the regional office. I'm based in Ouagadougou, West Africa, and I lead on the COVID-19 vaccinations for the sub-region, which is for West Africa. I'm delighted to be here and really excited about discussing this scorecard. I'm also a member of the Boost community.
Wonderful, thank you so much. And thanks to all of our Boost members for helping today. So with that, I think we're gonna go ahead and transition to breakout rooms. So I put everyone in a room, and within a couple seconds, you'll see a pop-up. So we just ask that you join that room for, again, a little bit more discussion on the scorecard and getting some of your feedback. Rose, am I missing anything from your perspective?
Oh, I think this is the moment to hear from the members. Thank you.
Great. So again, please just make sure to click on the link to join your breakout room. Thank you. Hello and welcome back. I think we'll get started in just a second. Just want to allow for everyone to rejoin the main room. And just a reminder to please stay on mute. Great, and I think we just wanted to kick off with a poll question. So in a second, you'll see a poll pop up. But just after your discussions, we're wondering how you foresee using the scorecard. So I'm going to go ahead and launch that poll and just give everyone about 15 seconds to answer. And you can select multiple choices. All right. So it looks like our top responses are updating health ministry on immunization systems performance. And that's actually tied also for advocacy for resources. And then close behind is coordination between vaccination partners. And then last but not least, use for visuals of conference presentations. So I wanted to turn it over to Rose. I think she's going to be leading the report out from the breakout room. So over to you, Rose.
Yes, I was just going to respond to a question in the chat from Maya. And that was that Maya said she can't see the country pages. And yes, exactly. So the country pages, we're having this opportunity to get feedback from you all because we are hoping to include the feedback and the some of the revisions for the scorecard that you've seen today, especially the country pages. And so the country pages will be published later this year when we have data from 2021 to present there. So that might be a little confusing. Yeah, they're not yet public. So from our group, we discussed a few reasons to use the scorecard. Just looking at my notes. Participants said that the scorecard is easy to understand at a glance and not too busy. And so because it's so simple and visual, it can be used for advocacy with senior level people who are so busy, they don't have time to go into the data. That will be something impactful to help them make decisions. So that was a really important bit of feedback. We also heard that seeing the trends year by year, all the charts in the line, you'll be able to see at a glance where there's a shock to the health system that has affected all of these indicators. As discussed, we do expect to see indication of the shock that the pandemic has been in 2020, 2021, where we see, unfortunately, some of the indicators backsliding, as we've seen with the number of zero-dose children in 2020 already. And we'll also see those kind of indications for coverage. We also heard some questions about whether you'd be able to compare region to region, and that was something I didn't show in the first presentation on the scorecard, but each of the views can be toggled by region. So you can just look at all the indicators on your dashboard for one region, for example, the regions of the Americas, and see how things are progressing, where there's backsliding in just that one region. And you can also dive in at each of the indicators to see how the indicators look and how they compare with the associated targets by region. So I wanted to make sure that was clear. So those are, I think, the findings from our group.
Great, thanks so much. And just wanted to have a representative from the other groups. So maybe over to Hilarious, if either you or someone else in your group wants to share.
Yeah, so Hosea will share from group 3, where I was, and then I'll add on.
Yeah, thank you, everybody. So thank you, Hilarious, for leading our group. And one of the first things that came up from our group was the question about privacy and access of this data. And I think the response were that the data is going to be readily available for everybody. And I think one of the members also added that the data can be downloaded. And to my experience, this is one of the things that come up first when you talk about dashboards. People want to be able to download things for other works. So this is great. I think also the question were around, again, about the privacy and the access. I think this was not covered widely, but I think it was about how countries feel about having the data out there, to be viewed by other people. And I think the question were, if the data is going to be anonymized in a way that no one is going to know where this data is coming from or something like that, I think we can talk about this maybe next time. But also there were questions from the member about the the training that will be necessary for us or other users to be able to get familiar with the tool, and then about our experience, about other dashboards, other systems that we do have in place that look like this scorecard or something, or any other way that we can be able to tell about the progress of the immunization steps, respective countries or places of work. So lastly, one of our group members shared the experience about where they work, and they mentioned that where they work, they do have different registers in different health, immunization service provision levels, and that the information from those service provision points is being aggregated and shared to the national immunization system, where they have something that is similar to the scorecard that inform their progress. But I think the main difference and the key learning from that point is the fact that the IA 2030 scorecard is different because it gives the regional and global view of the service provision, where you can be able to compare yourself with other countries and know how you do. Thank you. Over to you, Hilarious, for any additions.
Right. So one of the things that came up from a group was the fact that the participants felt they hadn't had enough exposure to the dashboard or the scorecard. And so as at the time of the discussion, some were still trying to open up the pages. And that's where the question about whether there will be any form of training, for people who may routinely want to use the dashboard or the scorecard. And then also what came out clear is the idea of being able to compare, data from your country with the regional or global progress, among other things. And then the discussions about what countries are currently using in terms of monitoring data and progress on immunization services and how these adds on to it. So those were the few other thoughts that came up during the engagement. Over.
So may I just provide some updates from my team?
Sure, go for it.
For my breakout room, we had really great feedbacks, and many thanks to members of the team for the objectivity. The first thought was that the colors and the layout of the presentation, that it was great. It was simple. There was a suggestion to add the year or quarter of the indicators that are being reported. There were also questions around how the data was being sourced. So particularly looking at, so it would be great to provide a note on how the data is being sourced, how to ensure the quality of the data being reported, and the method of data collection. So the team felt that wasn't being showcased. It was also not clear what the level in which it is being applied. So the person was looking at the depth, if the data was being sourced from the family level, from hospitals, districts, or what age group is the data is being sourced from, or the level in which it is being applied at. On the response column, some of the feedback included what is meant by yes. So, if you look at the response of countries, you will see where for some indicators it says yes. So that is good to qualify what that means. And someone has added that it may be better if definitions can be added. So if you hover on the terms, you could have definitions to each of these terms, come up. For example, health of the vaccine market, just so that it's easy for people to understand. Generally, it was agreed that it can be used in advocacy, but I think just like the other speaker said, a lot of team members also felt they would need to have to play around with the scorecard, just to provide a bit more, much more holistic comments. Over from myself.
Great, thanks so much. And then yes, if you want to go briefly, and then for our other group facilitators, just ask that you put your insights into the chat since we're running out of time. Over to you, Amin.
Thank you so much. The discussion in my breakup room was really too much healthy and fruitful, and the interest was really very positive from the participants. As whenever I have through a question that what are the strengths and what to predict about the scorecard in the future, so Dr. Shanika replies in such a way that we need some suitable time to study the scorecard. That in short time, I will not be able to give a pure conclusion about it. So it also shows their interest in this thing that they want to study about it. Moreover, they say that the indicators should be such that they can be comparable across the country. Standardizing and harmonizing indicator definition should be a priority. And whenever I would discuss about its visual display, so they say that being a unity, it surely be an easy and ready to use tool for all levels of all health care workers in understanding the gaps and to progress. So moreover, they think that whenever they going to implement for it, they need some of improving the methodology, which would give the capacity, increase the internal capacity, and data collectors who are working on it maybe needs to be strengthened on it. So overall, there is a very complete and good discussion on it. They are eagerly, some of them are not verbally participate, but they give their comments in the chat box, and which shows their interest in the scorecard. As concluding the thing that I think that in the future that the country's heads and will be really too much interested to launch a scorecard, which will be helpful for comparing the sub-national data with the national data, and also will be helpful to compare their countries with the same region and other region that where they are standing for the immunization activities right now. Thank you so much.
Wonderful, thank you so much. And I'm sorry to our other group facilitators, we're a bit out of time, but continue to please share your insights in the chat. I'm going to go ahead and I just want to share out a few more links before we end the session today. So again, we do encourage you to visit the Immunization Agenda 2030 Scorecard website. We'll continue to release updates on the scorecard there. Also, obviously, if you signed up for this event, we'll also share information via email as well. Please do join or visit the Boost community to receive the recording and slides from this event. We also have a Telegram channel where you can receive timely updates. And then last but not least, we do ask that you fill out a session survey just to give us some feedback on how we did today and how we can improve for future sessions. And also just wanted to share a few upcoming Boost events. So we have an upcoming event as part of our Behavioral Science Immunization Network that's coming up on June 14th. So again, we'll send out details on this event in the follow-up email, but we do encourage you to join the Boost platform and to join that learning group. We also are offering a new course starting, the deadline for that course application is on June 15th, and then the course will start shortly thereafter. It'll be on gender and immunization opportunities for action. So we do encourage you to check that out if you're interested. And then with that, I know that we went a few minutes over, so thanks so much for your patience. I want to thank all of our speakers and our breakout room facilitators for today's session. Really appreciate your help and your feedback. So thank you for all of our participants for being very active in the breakout rooms and sharing your feedback. We really appreciate it. And with that, I just want to, again, thank everyone and hope to see you soon on the Boost community platform. Thanks, everyone.
Thank you so much.
Thank you.
Thank you, everyone.
Have a great day.
Thank you.
Thank you. Bye.
Thank you.